Right, so we are in week 2, and I'm going to spend the next few minutes reviewing the assignments for this week. So for week 2, you do have 3 chapters to read, and that is chapter 25, 26, and 27. Those are your special populations, so children, infancy through adolescence, pregnant women, and the older adult. And then your Bright Futures guide, be sure that you are reviewing the ages 1 through 12 and immunizations in it. That is a required text for this course. Other important reminders for week 2 include your shadow health. And so in this week, you will only have one module that will be focused on musculoskeletal. So remember, this is the only other week outside of week 1 where you do have more than one attempt available to you, or that flexible turn in. I do recommend that you spend as much time as you need, again, to navigate that course. So there is a student guide available for you. Please be sure that you're looking at it, making sure that you are answering all the questions and asking all the questions that you need to in order to get all of the points appropriate for shadow health. And we are using those digital clinical excellence scores, as I mentioned, in your town hall meeting. For your key banks, you should have access in week 2. And so that will begin in terms of the Q banks associated with assignments. So you do have 2 assigned Q banks this week, and those are your GI as well as your STD. You need to make sure that you are earning an 84% or better on those Q banks. So remember, if there is not 40 questions, such as with the STI bank, you need to make sure that you are doing the entire Q bank. However, if the module does have more than 40 questions, the minimum is 40 to complete. You will submit that screenshot at the end of your results, as I did show in your town hall meeting. And that needs to show us how many questions you completed, the correct answer, the number of correct and the percentage, and it needs to show a time mark for this term. Your week 8 project will be introduced in week 2. And so during this week, you can expect that your instructor will either put you into groups or ask you to work together and make your own groups. And then in week 3, you will get clinical scenarios for your week 8 project. So more to come on that. This week is also very important as you have your virtual immersion on Thursday. So be sure that you are getting prepared for your immersion experience. That is at 7 a.m. Pacific Standard Time to 4 p.m. Absolutely need to have your camera so your background is not blurred, as mine is not right now. You can see that you are in a well-lit place. We're able to see you in professional attire. You are not working, you are not traveling, you're in a professional manner. So please be attentive and make sure you are on time to your virtual immersion experience and plan to be there for the entire duration of the day. You will have dedicated breaks in between lecture as well as time for lunch. So you do not need to worry about those things. And if you have any accommodations, such as breastfeeding or anything that you need to mention, those would go to the immersion team prior to that day. So again, virtual immersion, those lectures will be presented by professors. Refer to Nursing Caring Corner and the email sent by the immersion team for more details. Attendance is mandatory, as I did mention. Failure to attend on time and for the duration of that day will result in being unsuccessful in completing the course. So you will need to contact your advisor if something comes up, a family emergency, you're not able to make it, as there is no makeup assignment for that day. You will see in your course that you will have an announcement posted in Thursday of week 2, again, with the date and the link. You also will need to make sure that you change your name on Zoom to the name that you are registered with for USU for attendance purposes. And then the link for tips for successful virtual immersion prior to attending. And then the link will be posted again. You will receive that in an email, but will also be posted in an announcement for you. For on-campus immersion, just to discuss briefly, that's going to come in weeks 3 through 5 for those of you in designated weeks. Those assignments are going to be due the following Monday after attending immersion. So not the day after, but 8 days after, being as you're going to finish immersion on a Sunday. You will submit all 4 documents, including a problem-focused SOAP note, skills checklist, a self-evaluation form, and the standardized patient evaluation form. MSN572 assignment extensions will occur during those weeks that you attend immersion. So if you are in week 3, Your your abdominal video that's due in week 3 will actually have a longer due date to allow you time for travel to immersion. If you attend in week 4, that will be your HENT video and so on and so forth with CV and pulmonary. In week 5. Shadow health and Q banks do not have extended due dates, so please plan accordingly. Again, you can work on those in advance. As soon as you receive Q bank access, you can go ahead and start working on those. And then for shadow health, you're more than welcome to work in advance as you please. For your head to toe, that is what I will cover during this video. So this is not something that is going to be due until week 5. However, by allowing you time to review the information and prepare accordingly, your videos are going to help scaffold up to this head to toe. So I do want to introduce you to the idea and the rubric that you're going to be responsible for in the few coming weeks. But again, it's not due in week 2. So things that you'll need to know for week 5, which is where your head to toe drop box is you will need to go ahead and submit the consent of the patient. And again, all of these documents will be found in week 5. That needs to be a patient who is 18 or above with a signed consent and uploaded to the Dropbox. You will also obtain verbal consent from the patient at the beginning of the video. That's going to, again, state that you are a FNP student at USU, and you're going to upload the video as unlisted for grading purposes for your instructor. You're also going to mention in this video that any abnormal findings must be followed up with patient's primary care provider or a healthcare clinician, as you are not responsible for those findings. You will need to submit a valid government ID. So please be sure you are not showing that in your YouTube video. You need to make sure that that is only submitted into the Dropbox. If you have your USU ID or any other form of ID on in your video, or you do try and show that in your video, YouTube will remove the video. It will be taken down. As I mentioned in town hall, the only way to submit your video to your instructor is by submitting the YouTube link. So if YouTube takes it down, they're going to continue to take it down. You're not going to be able to submit that video. You will have to re-record. That is on your best practice checklist. So when you are reviewing your best practice checklist, you are stating that you did not show your ID in the video. That's very important. We've had many students in the past who have tried to continue to re-upload their video, and YouTube will just take it down repeatedly. So you will need to re-record. In terms of the checklist that I just mentioned, that best practice checklist is in week 5. You're going to review that. That's got a pre-recording, during recording, and after recording stage on it with multiple bullet points so that you're reviewing those. You're going to sign that with your name and upload that to the Dropbox. And then, of course, your YouTube video link, as I've mentioned. So prior to recording, and this is based on your checklist that I just mentioned to you, you are in professional attire, so no scrubs. You're going to wear your USU lab coat, but not your ID. There's going to be an integrity check that you're going to do. So what you are going to show is a mirror of your device. You're going to basically hold that up and show your device that you're recording against. And so we can see there are no notes behind you. You're going to perform a room scan. So you're going to then take your recording device, whether that's your desktop or a webcam or your phone itself, and you're going to do an entire 360. You're going to show the ceiling, you're going to show the floor, you're going to show the entire room, so we know that there are no notes anywhere. Then you're going to perform an ear check where you're getting close to the camera. You're showing that there are no hearing devices in your ears, and that you are completing your integrity policy. And so that statement, again, is on your best practice checklist. And you can have that checklist available prior to starting your actual video itself, but you can have that while you're doing all of these pre-checks and stating the integrity pledge if you're not able to remember it. The environment should be well lit, a quiet place, a place for the patient to sit, as well as you as the nurse practitioner to sit, and then a place for the patient to lie down, as you are going to need to perform many of the exam skills in a seated position, along with having the patient lie down for their abdominal exam, for their cardiovascular exam, and then showing area where the patient is able to walk for a gait, and that will be part of your neuro and MSK. For comfort, you should have a pillow, a blanket, or something that you are able to cover the patient with for comfort, and the patient should be in loose fitting clothing. In terms of equipment that you'll need, you need to absolutely be sure that the device that you are using has power or is plugged in to a recording device. All supplies are within reach, so you may not exit the camera view at any time. You must be within the frame of the camera. So all supplies, whether you have those on the bed or a chair or something next to you, you need to have all of your supplies within reach. And the supplies that you'll need for the video, again, these are directly from your best practice checklist. And then a blank piece of paper if you choose to use it for your brain dump. So we do allow you a single sheet of paper, and you'll show that again at the very beginning. You're going to show the paper, the front and the back, that has nothing on it. If you choose to use this brain dump, a lot of students like to utilize it for remembering their cranial nerves or maybe a certain step that they forget. And at the end, you may want to be able to go back through that checklist and realize that you met all of those objectives prior to submission. So the blank piece of paper is called the brain dump. Again, if you are using it, your video is going to have a time limit of 60 minutes. So from the time that you start writing, after you've completed all of your pre-checklist, you've shown your ear check, you've done your room scan, you've stated your integrity pledge, from the time you start writing, that is considered the time of exam. That is brain dump to the conclusion of your video, 60 minutes. So be very sure that you are aware. Anything over that 60-minute time mark is not going to be graded by your instructor. So it doesn't matter if you have the most perfect video, if it's 65 minutes, anything over 60 minutes and 1 second is not going to be graded. So please be very sure when you are watching your video that you have managed to do all of the skills according to the rubric within that time frame. In terms of first steps during the recording, you are going to introduce yourself, your full name, that you are a USU FNP student, introduce the patient. You're going to ask for their full name, age, and verify they're the same person of the written consent. And then exam consent. So you'll upload that to YouTube, as I mentioned. The purpose of this is a mock physical or a wellness exam. Any abnormal findings or concerns must have follow-up with the PCP. The video has the room scan, mirror check, ear check, brain dump, equipment check, the attestation statement. After these steps, as I just mentioned, the 60-minute time limit does start when you start writing for the brain dump if you choose to use it. Otherwise, going straight into the interview. So during the recording, we must be able to visualize you at all times, that you are within the camera frame. If you exit the camera frame for whatever reason, you do need to re-record. If you submit that, that will count as your first attempt, in which you will receive a 0, as that is an automatic not pass situation, as that is against the rules. So communication with your patient, you need to verbalize each step and the associated findings. In terms of a good example here is, I'm examining the inner ear by pulling up and back on the pinna, bracing my hand for safety. I'm looking at the external canal, which is clear and non-erythematous. That you're seeing the tympanic membrane, that should be pearly gray and not bulging or retracted. You're seeing the cone of light at 5 o'clock, seeing the umbo and the short process of the malleus. So those are all things that you are going to be stating during your exam. We need to hear you verbalize as well as physically perform for the areas we cannot see ourselves. You do need to make sure you're using anatomical landmarks and performing bilaterally. The patient should be in a comfortable position, ensuring that they are covered and not exposed. The flow of the exam should be fluid in terms of positions. You should not have the patient change positions frequently. And I did mention bilaterally. If you do have findings that are the same on both sides, you can say findings are consistent with the first side if you have thoroughly explained the details. In terms of visualization of the ears, you'll see that the cone of light is different. So if there are different findings based on anatomical landmarks, you do need to mention so. And now we'll get into the rubric section specifically. So you will see each title at the top of the slide will go over the area of your exam that you need to complete. Okay, so those are your headers. And then there is no associated documentation with your head to toe video. It's strictly the video itself and the checklist that I've mentioned before, as well as the consent. So for the initial approach and history taking, you need to have those documents submitted. Without those documents, we cannot grade your video. You're getting 0.5 for introduction. You're also getting 1 point for hygiene. So at some point prior to physically assessing the patient or touching them, you must either say or show that you are using hand sanitizer. And then obtaining the patient ID, as I mentioned, that's another half a point. Chief complaint gets you 1 point, and that's a wellness exam. And then the history of presenting illness. So given it's a well exam, you would verbalize asking the patient more questions if they did have a reason for the visit. And you should be stating to the camera that you would use the OLD-CART acronym. Again, what is OLD-CART? That's onset, location, duration, character, aggravating and alleviating factors, radiation, timing, and setting. So for the purpose of this exam for a well visit, you would not likely need that OLD-CART acronym, but you would verbalize all of those steps to the camera. In terms of past medical history, so you're going to be asking the patient about their general health. So can you tell me, how would you state that your level of wellness is? Are you overall healthy and well? When was your last physical exam? Have you had any abnormal findings? You can ask about any chronic illnesses. If they say they don't have any, you would also, again, look at the camera and you'd state, I would ask if they did have any about the conditions themselves and how they're being treated. Psychiatric, again, if they don't have any, you would turn to the camera and state, I would ask about any history of previous or active psychiatric illness, any treatment and hospitalizations. Ask the patient about any infectious diseases. This one is often forgotten, so please star that on your own in terms of remembering to ask about tuberculosis, HIV, AIDS, hepatitis, allergies and reactions. And again, as a review in week 1, that is environmental, drug, and food allergies. Medications, even if the patient states none, you would turn and state, I would ask them about the medication, the name of the medication, dose, timing, and the purpose. Surgical history, when, what type, what complications, if any, and any anesthesia. Hospitalizations and injuries, again, you're going to ask about that. Immunizations, asking if they're up to date on their childhood immunizations, their last flu vaccination, as well as their COVID series. Gynecologic history, even if you have a male, you're going to then turn to the camera again and say, if my patient was a female, I would ask them regarding the factors of their gynecologic history, such as their last menstrual period, patterns and characteristics regarding it, about their pregnancy history, complications. With sexual history, you're asking both male and female patients about this, their partners, sexual practices, history of STIs, protection, and pregnancy plans. And then for health maintenance, both male and female patients should be asked if they're performing self-breast exams. For female patients, we're asking about gynecologic exams per the American College of Gynecology guidelines and testicular exams for males. All of those areas are going to get you 1 point each. In terms of your past medical history or your family history, you're going to ask the patient on the genogram about their children, any siblings, their parents, their grandparents, and you're going to need to know ages or rough estimates of age, their overall health and any health conditions, and the cause of death. That's going to get you 1 point. And then you are going to need to do some research in your Bates book here. So when you'll see each body system is in its own box worth 1 point, but you'll see some areas ask that you need 2 to 3 examples and some have 1 to 2 examples. So you need to do your own research on health conditions that are in HEENT that can be inherited, right? What are these conditions that we're asking about with family history, like glaucoma, cataracts, cardiovascular disease, that's going to be coronary artery disease, MIs, neurologic, like stroke. Certainly a stroke is a very important risk factor to know about. So if it's 2 to 3 examples, you're going to ask that. If it's 1 to 2, you'll ask about those. So all of these need to be asked: HEENT, cardiovascular, neuro, pulm, GI, GU, endocrine, musculoskeletal. You're going to need to ask the patient about any family history of obesity, any family history of any forms of cancers, bleeding disorders, mental or psychological disorders, genetic conditions. And again, those are going to be a little bit different than what you've already asked about above. That could be sickle cell disease, Tay-Sachs, things like that. Substance abuse history within the family and any familial allergies we should know about, such as iodine. Social history, you're going to ask the patient about their place of birth, their race and nationality, and then their ethnicity that they identify with, their marital status, occupation, military history, social and economic status, their habits in terms of diet, if any restrictions, hydration, their nutritional status, exercise, laxative use, and caffeine use. Again, for tobacco, you want to ask about smokeless tobacco as well, and vaping, and any alcohol or drug use. For emotional stress and sleep, you're going to ask them what they rate their level of stress at. How many hours of sleep are they getting a night? What do they do for their hobbies or any alternative health practices? And then in terms of violence and safety, you're asking about texting and driving, wearing a seatbelt in the car, those types of things. If they have a gun in the home, is it locked up? So you will review your Bates book, and this should be a heavy review of week 1 of those interview questions and the reading that you've completed in your Bates book to help guide you in terms of the interview prior to you performing the remainder of the physical assessment itself. The review of systems, you'll see that there are several symptoms associated with the body system here. You should be asking these as common practice, and it needs to be multiple symptoms that you're asking about. So this is the list directly taken from your rubric. You should be asking about everything that I have listed here in order to receive full credit. So when it comes to constitutional, and a review of systems is about the patient themselves, not their family members. So those review of systems and the family history cannot be grouped together. They are not the same thing. The review of systems are questions asked to the patient, because as you document a review of systems, remember that's the patient reports or the patient denies. So they're either reporting overall good health, that they deny fever, chills, weight loss, and fatigue, right? Those are how you would document those things. With eyes, you're asking about changes in vision, specifically blurred vision, double, tunnel vision, or floaters in their last eye exam. ENT and mouth, and I won't go through all of these systems. As you can see, all of the symptoms are listed for you. Again, this is directly from your week 5 head to toe rubric, just listed on a slide for you, so it's much easier to see. Every system here is going to get you 1 point, so you can see it's very important, as all of these points are going to add up. For your general survey, this is now the point that you're performing your physical exam, and you must verbalize these aspects to get the 2 points associated for this general appearance. So you're looking at the patient for their hygiene and posture, their state of health, mobility, did they walk in ambulatory, steady gait, independent, their level of consciousness, are they attentive, what's their expression and orientation, affect and mood, signs of distress, what's their ease of breathing, is there any difficulty or distress, their nutritional status. So you're verbalizing all of those things to the camera. In terms of metrics, you're verbalizing that you would assess the height and the weight of the patient. You can make those numbers up, or you can ask them on camera and estimate their BMI. And then vital signs, you're going to verbalize obtaining these. You do not physically need to show us obtaining the heart rate, oxygen level, temperature, or blood pressure. For overall technical skill and making sure that you ask all of those questions, we give you an additional 2 points for your general survey. Now we're on to assessing skin, hair, and nails. So inspecting the skin for skin moisture and dryness, for rashes. We're looking at the skin color, and we're verbalizing that there is no pallor, cyanosis, jaundice, erythema, texture of the skin. We're verbalizing those findings, as well as the temperature if we're visualizing any clubbing. For inspection, we're also looking at the nails for appearance, turgor, clubbing, color, texture, and joint swelling, hair distribution, and then facial swelling, edema, or asymmetry. For verbalization, you also need to mention for skin, hair, and nails that you are performing the ABCDE method of evaluation. And I will let you again review your Bates book. That's asymmetry, border, color, diameter. Inspecting that you're looking for scars, vascular lesions, suspicious tumors. You're verbalizing any changes in the skin, hair, and nails. You're going to want to mention that you're looking for macules, papules, vesicles, pustules, and those types of lesions. Again, that will get you 4 points for that section. Exam of the head and neck. So you're inspecting the head and neck, looking at the facial expressions of the patient for facial symmetry, any signs of edema. You're then going to palpate the head and the scalp for shape, appearance. You're going to mention any of the scalp appearance, texture, hair loss, and lesions. And then you're going to palpate the face. And this is going to give you 3 points for just palpation of the bilateral TMJ, the temporal arteries, and then you're going to palpate over the frontal and maxillary sinuses right here in the frontal. Assessing the motor and sensory function of the trigeminal nerve, as well as assessing the function of the facial nerve. You do need to make sure when you are talking about cranial nerves, you're mentioning the name as well as the cranial nerve number in order to receive full credit. If you don't mention both, you will only get partial credit. For examination of the eyes, you're going to inspect the findings and verbalize these on the eyelids, sclera, conjunctiva, cornea, iris, lens, and pupils. You're going to assess for perla. Pupils are equally round, reactive to light, and accommodate using your pen light. That's going to give you 3 points. Assessing for visual acuity with the Snellen chart, and you're visualizing the findings for the cranial nerve 2 or the optic nerve. So you're going to have the patient cover one eye. They're going to read the lowest line that they can on your pocket Snellen chart. Then they're going to read the lowest line that they can with the opposite eye. And then if they're using any sort of corrective lenses, they're going to have those on during that time, and then they'll read the lowest line again. You will need to measure that in terms of the patient's acuity. So 20/20, 20/25, based on whatever line that they can read. You're going to assess for extraocular movements. So the 6 cardinal positions of gaze, those are cranial nerve 3, your oculomotor, cranial nerve 4, which is your trochlear, and then cranial nerve 6 is abducens. The eye movements that are associated with that are listed for you. You'll learn more about that in week 4. Verbalizing, looking for an nystagmus. So in performing those, you're going to look for that vibration of the eye, or any abnormal findings would be nystagmus there. The ophthalmoscopic exam. So verbalizing identification of the red reflex, the retina, the vessels, the optic disc, the disc to cup ratio, the fovea, and the macula. That will be discussed briefly in your on-campus immersion. Again, that is in week 4 of your reading, so you'll get to that shortly, but you are going to use your ophthalmoscope and have one of those given to you as part of your skills equipment. You're going to perform that correctly, so you're going to hold the ophthalmoscope with your right hand when looking at the patient's right eye and using your right eye, and vice versa. For examination of the ears, you're going to be using your otoscope for this. You're also going to be using a tuning fork. So you need to, again, make sure all of the equipment is available to you within reach and within the camera view. You're also going to assess the external examination of the ear by appearance. You're going to palpate for tenderness, both in front of the ear, behind the ear, and at the ear itself. And then you're going to assess the canal for obstruction. So you're going to go ahead and put an otoscope cover on your otoscope, or a speculum. You're going to pull the ear back, and you're going to look at the cone of light into the ear and verbalize those findings as we talked about. Then you're going to need to assess cranial nerve 8, which is your acoustic cranial nerve, by several tests: the whisper test, the Rinne test, and the Weber test. And so you will again use your tuning fork for those. The otoscope exam, that you are performing those correctly and that you're using safety in terms of your placement. For cranial nerve 1, your olfactory, you're going to be testing this first with inspection of external appearance of the nose, testing for patency, basically having the patient occlude both of their nostrils independently and having them sniff. Then you're going to visualize the nasal mucosa and turbinates for appearance and drainage with the nasal speculum. So you're going to change out the speculum with your otoscope. You're going to visually look with light into the nasal mucosa. And then assessing cranial nerve 1, the olfactory nerve, by sense of smell. So you'll have the patient close their eyes, have 2 distinct scents, and you're going to have them occlude one there, and then you're going to have them smell that and detect the scent correctly. For mouth and throat, inspecting the lips, teeth, gums, tongue, buccal mucosa, the soft and hard palate, as well as the anterior and posterior pillars. Inspecting and grading the tonsils, and assessing cranial nerve function. So there are 3 cranial nerves associated with the mouth, and that's cranial nerve 9, glossopharyngeal, cranial nerve 10, vagus, and cranial nerve 12, hypoglossal, and their associated movements and functions there. So you will need to, again, verbalize the name as well as the number and their function as you are performing and testing the cranial nerves. Examination of the neck. So you're assessing for symmetry and enlargement. You're going to do that at a tangential view, looking on the side and having the patient look up. You're looking for any evidence of goiter. You're going to palpate over the lymph nodes. So pre-auricular in the front, posterior auricular in the back, occipital all the way in the posterior scalp, tonsillar. You're going to do the submandibular, the submental, the anterior cervical in this chain kind of in a triangle, the posterior cervical, and the supraclavicular. You're going to be inspecting and palpating the trachea for any evidence of deviation, examining the thyroid, assessing cranial nerve 11 for function is going to be you're having the patient shrug their shoulders for you up against your pressure of your hand, and then trapezius strength. So you're basically going to have the patient push up against your hand, and you're going to test that bilaterally. Remember, you're doing everything bilaterally with this patient. Observing for any jugular venous distension. So that measurement is not required, but you would mention that as part of your neck examination. And then we're giving you 5 points for technical skill during your exam. So you are gaining several points if you're doing things correctly. Examination of the thorax. So you will not disrobe your patient for the purposes of this video for modesty. However, you would state that in an appropriate exam setting, you would ask the patient to take their shirt off, and you would be looking at their bare chest, going ahead to use a gown or a robe to keep the patient covered while you are not assessing other areas, but you're looking at the appearance. You're going to verbalize the appearance: lesions, rashes, chest wall deformities. Inspecting for symmetry of the thorax. So you're looking at the respiratory rate, effort, and rhythm, and any abnormal breath sounds. You're going to look at the chest in the front as well as on the side and the back, looking for AP ratio of the chest, and then palpating the sternum for tenderness. So you should be palpating with your hands for that. Examination of the posterior thorax or the back portion. So you're going to palpate the intercostals of the back and the spine for pain, tenderness, and abnormalities. Assessing for respiratory excursion and expansion, you're going to palpate for tactile phragmitis, percuss the posterior fields, assessing for diaphragmatic excursion, and you're going to measure that. And again, these are going to be in your week 5 videos. This is just introducing you to the skill. Auscultating the lung fields, so it's going to need to be a minimum of 8 areas, and displaying the overall technical skill. If that gets you additional 4 points. The anterior thorax, you're going to palpate the chest again for pain, tenderness, abnormalities, assessing chest expansion, palpating for tactile phragmitis, percussing the anterior and lateral chest, and auscultating the anterior chest. And for this is respiratory. Now we're into cardiovascular anterior chest. You're going to inspect the patient's chest for heaves and lifts. You're going to palpate for any heaves or thrills on the chest, and you should be palpating in all areas. Then you're going to palpate for the apical impulse, and that's going to be at the 5th intercostal space midclavicular line. You're going to assess the carotid arteries through auscultation as well as palpation, doing those at one time individually, so you're not causing any occlusion. Auscultating the heart sounds, so you need to verbalize the anatomic location as I just did for apical impulse. You're going to do that for aortic, pulmonic, Erb's point, tricuspid, and mitral. So you should be palpating first, then you should be auscultating with the bell, auscultating with the diaphragm. So oftentimes students like to go through all 5 locations with one bell and then go back again through with the diaphragm, all 5 locations. Or if you would like to just go ahead and turn it at each location, you can do so, but you do need to mention the anatomic location as well as the landmarks. That needs to be done in a sitting and a lying position. So remember, I said we want you to move your patient as less as you can, as least as you can. So at this point at the anterior thorax exam and cardiovascular, you can go ahead and have the patient transition from that sitting position to lying, as the next portion is going to be abdominal. You do get an additional 5 points for overall technical skill. And now we're on to our abdominal portion. So the patient should now be lying down. You should have a pillow positioned under their knees for comfort, as well as maybe a pillow behind their head and keeping their legs covered, as you should be exposing the abdomen just to below their diaphragm, and you don't need to expose any femoral area when we get to that point, but you do need to verbalize those as appropriate. So you're inspecting the abdomen for contour, pulsations, heaves, symmetry, skin conditions, scars, or hernias. Auscultating first. So in terms of auscultation first, you want to make sure that you are doing that to not displace any organs and listening to bowel sounds appropriately. You're going to assess in all 4 quadrants. Then you're going to assess for bruits. So placing your stethoscope in the anatomical location of the abdominal aorta and mentioning that location. Then bilateral renal arteries, bilateral iliac arteries, and bilateral femoral arteries. For the purposes of the video, again, you're not going to disrobe your patient, but you can place that over their clothing for femoral, but you would again verbalize skin to skin contact would be the best way. Percussion in all 4 quadrants and palpating all 4 quadrants. So you're going to do that in a light manner first and then deeper. Percussing for liver span. So you're going to perform that in your week 3 videos. So this should be a review, and you're going to perform this again in your head to toe. So get very comfortable with the skills in each weekly video. Palpation of the liver, percussion of the spleen, and palpation of the spleen, which in a patient who is not otherwise unhealthy, you should not be able to palpate the spleen or the liver. Palpation of the kidney areas, palpation for aortic pulsation and pulsatile masses. Again, that would be an abnormal finding, but you should be palpating over those areas. Assessing femoral pulses and inguinal lymph nodes, and assessing for CVA tenderness. So at that point, from lying down, the patient can now be sitting up again, and you should show how you are percussing over the CVA area to assess for tenderness. You're getting an additional 4 points for overall skill there. So now that the patient is either back sitting or standing, you can perform your inspection of your spine. So inspection involves posture, verbalizing shoulder and hip symmetry, looking for lordosis and kyphosis. You're then going to palpate over the spine for pain and tenderness, assessing for scoliosis by having the patient bend forward. Assess for range of motion of the cervical, thoracic, and lumbar regions of the spine, and those are practiced in your MSK video in week 7. You're getting an additional 2 points for overall skill. Examination of the upper extremities. Again, this is going to be reviewed in week 7. This is just your introduction to these topics for your head to toe. Inspection for shoulders, elbows, wrists, and hands. You should be using all of the anatomical landmarks, and as many of you like to submit this video during week 7 after you've completed all of your body system videos, this will again just be a review. So please reference those dedicated rubrics and the associated Bates reading themselves. This is just the introduction of these topics for inspection, palpation, and evaluation of range of motion and muscle strength. You're going to do that for all areas: the shoulders bilaterally, elbows bilaterally, wrists bilaterally, and hands bilaterally. You're going to palpate the epitrochlear and axillary lymph nodes. Assessing for deep tendon reflexes, and those are your bicep, tricep, and brachioradialis. You're going to use your reflex hammer for those. For sensory assessment, you're going to do 2 to 3 points on each upper extremity, testing for sharp and dull detection, and the patient should have their eyes closed. You should touch them with a sharp object, a dull object, and alternate back and forth in different locations with correct identification from the patient. You're going to palpate for radial pulses and discuss the capillary refill that you're assessing, and then additional 2 points for overall skill. Lower extremities, again, inspect, palpate, then evaluate range of motion and muscle strength for bilateral hips, knees, ankles, feet, and toes. Assessing popliteal, dorsalis, pedis, and posterior tibialis for your pulses, and you're going to assess those and detect and verbalize them. Assessing your deep tendon reflexes, and those are your patellar and your Achilles tendon. Your superficial reflex that you're going to use your reflex hammer for is your plantar pedis or your Babinski. Sensory assessment, just as I mentioned on the upper extremities, you're going to perform that on your lower extremities. And then, as I mentioned, you need to have a wide area of view so we can see this. You can position your camera from the point that the patient was otherwise sitting and now lying and standing. You can position your camera in a different place as long as you do not go out of the frame of view to show the patient's gait, coordination, and balance, and the testing associated for that. Again, that's in MSK week 7. The overall skill for lower extremity exam gets you an additional 2 points. You just need to make sure you're not going out of the camera view at any point. And finally, we give you 2 points for your communication and professionalism, which are given. You should be wearing a wrinkle-free USU lab coat with professional clothing, and assured that your patient is in comfortable position and clothing during their exam, appropriate communication during the techniques, and accurate assessment of those. You can see all of the points are added up here. So based on each area of the rubric, you will have points delineated, and that's going to give you 183 points possible. You need to ensure that you have gotten at least 154 of those 183 points, or an 84%, to ensure that you are passing your head to toe without requiring a remediation attempt. So as long as you achieve an 84% or better on your first attempt, you will have passed this assignment, which is a pass-fail assignment. If you do receive less than an 84%, which you should not do, as you are watching your video and making sure you are going through the checklist, grading yourself prior to your best submission to your instructor, because we don't know how many times it took you to record. We're just seeing your best submission that you should be very proud of, and make sure that you got all of the points possible before submitting. But if you do receive less than an 84%, you have one single submission for remediation. That will have to be done within about 2 to 3 days from the time of the initial submission. And so if you're submitting on day 7, week 7, that's not going to give you a lot of time to get that video back to your instructor. So again, we want you to be very, very successful in your first attempt because we have up to 4 days to grade these. So you will not likely receive your feedback from your instructor, which is going to take them over an hour of their time to watch with multiple students in each section. You may not receive that feedback usually within 24 hours. It may take up to 4 days. So please be very aware that in turning submissions in at the due date, the very last day, late into the evening, you may not have a lot of time to remediate if that's needed. So we don't want you to have to use that remediation attempt at all, but if you do need it, please make sure that you are prepared for the circumstances of not having a lot of time to practice once your instructor has given you feedback. I just mentioned this, but after the recording, prior to submitting, you're going to review grading it yourself. And if not, you need to make sure you're re-recording and repeating that step again prior to submission. You're within the frame at all times, easily audible, good lighting. You've uploaded the video to YouTube as unlisted. Do not mark it private. If you do mark it private, we will not be able to view it, and you will get a late policy intact in terms of your grade. So if you submit the video and it's set to private and you did that on the last day, we're trying to watch it in the next coming days, you will have a late policy in effect. Documents to submit, I went over that best practice checklist, that it should be signed and dated. There is no written documentation associated with this video like there are in your weekly videos. So that attestation statement states that you have read all of the items, checked that you performed and completed each item prior to submitting your video, understanding violations of academic integrity may result in a referral to the code of conduct, and penalty could include assignment failure, course failure, and program expulsion. So if you are found to be cheating in any way, you will not only receive a 0 on the assignment, but you will receive a failure in the course and possible expulsion from the program. All right, those are all of the areas to cover for this week. Please make sure that you are submitting your sync session summary. Again, you do have immersion in week 2, so be very mindful of those due dates in terms of what you'll have coming up with on-campus immersion, as I mentioned, but virtual immersion specifically, that you are attentive, that you have read that tips, the best ways to prepare for your virtual immersion, and that will be sent to you in an email, and then you'll log into that Zoom link. Please make sure you ask any questions that you have to your grading instructor, as they are the best resource available for you. And I wish you the best of luck this week. Have a great week, everyone.